Most people managing blood sugar after 60 are focused on what to stop eating, what to cut out, what to avoid. And while that matters, there is an entire side of this conversation that almost never comes up in a doctor's office. Not because the research doesn't exist, it absolutely does, but because what I'm about to share doesn't come in a prescription pad. There is a small group of seeds, ordinary seeds that have been sitting in grocery stores and health food shops for decades, that have been studied in peer-reviewed clinical trials specifically for their effect on blood sugar regulation, insulin sensitivity, and pancreatic function in adults with type 2 diabetes and prediabetes. Some of these studies showed results that genuinely surprised the researchers who ran them. And today, I'm going to walk you through exactly what the science says. Which seeds, what dose, what mechanism, and what to realistically expect, so that you can have an informed conversation with your doctor and make a decision based on evidence, not guesswork. I'm Dr. Wells, and this is WellAge Health, where we give adults over 55 honest, clear, research-backed health information in plain language every single week. Before we go any further, I need to say something important. If you are currently managing type 2 diabetes with medication or insulin, please do not make any changes to your treatment based on this video alone. What I'm sharing today is a supplement to medical care, not a replacement for it. The seeds we're covering have real, documented effects on blood sugar, which means they can interact with medications and affect your readings. Your doctor needs to know if you're adding any of these to your routine. That conversation is not optional. It's essential. With that said, let's get into the research. To understand why certain seeds have a meaningful effect on blood sugar, you first need to understand what's actually going wrong in type 2 diabetes and prediabetes. And it's not just about sugar. Type 2 diabetes is primarily a condition of insulin resistance. Your pancreas is still producing insulin. In many cases, it's producing more insulin than it should, working overtime to compensate. But your cells, particularly in your muscles, liver, and fat tissue, have become resistant to insulin signal. They're not opening up the way they should to allow glucose to enter. So glucose builds up in your bloodstream. Your pancreas keeps pushing out more and more insulin, trying to compensate. And over years, the beta cells in your pancreas and the cells responsible for producing insulin begin to exhaust and fail. This is why blood sugar management in type 2 diabetes has two targets, not one. The first is reducing insulin resistance, making your cells more responsive to the insulin you're already producing. The second is protecting beta cell function, preserving the capacity of your pancreas to produce insulin for as long as possible. The seeds we're covering today have been studied specifically for their effects on both of these targets, and in at least one case, the evidence is strong enough that researchers have called for larger clinical trials to explore it as a formal therapeutic intervention. Let's start with the seed that has the most robust clinical evidence. Fenugreek. Fenugreek is a small golden brown seed that has been used in traditional medicine across South Asia, North Africa, and the Middle East for thousands of years. For most of that time, the mechanism behind its effects on blood sugar was unknown. Over the past 3 decades, research has begun to explain exactly why it works, and the explanation is genuinely interesting. Fenugreek seeds are approximately 45% soluble fiber, specifically a type called galactomannan. When you consume fenugreek, this fiber forms a thick gel in your digestive tract. That gel physically slows the rate at which glucose from food enters your bloodstream. Instead of a sharp blood sugar spike after a meal, the absorption is smoothed out, flattened, which means less demand on your insulin system, lower peak glucose levels, and less stress on your pancreatic beta cells with every meal. But that's only the first mechanism. The more significant finding involves a compound found almost exclusively in fenugreek seeds called 4-hydroxyisoleucine. This is an amino acid that, in multiple animal and human studies, has been shown to directly stimulate insulin secretion from pancreatic beta cells, but only in the presence of elevated blood glucose. In other words, it acts like a glucose-dependent insulin trigger. It helps your pancreas respond more efficiently to rising blood sugar without causing hypoglycemia, which is the dangerous blood sugar drop that makes many diabetes medications risky. Now let's look at the clinical evidence specifically. A randomized controlled trial published in the European Journal of Clinical Nutrition gave participants with type 2 diabetes either fenugreek seed powder or a placebo for 8 weeks. The fenugreek group showed a statistically significant reduction in fasting blood glucose, post-meal blood glucose, and hemoglobin A1C, the 3-month average blood sugar marker that doctors use to assess long-term diabetes control. The results were not dramatic enough to replace medication, but they were clinically meaningful. The kind of improvement that, combined with medication and lifestyle changes, adds up to real protection against complications. A separate study published in the journal Phytotherapy Research specifically looked at adults with prediabetes, people whose blood sugar is elevated but not yet at the diabetes threshold. Over 3 years, the group taking fenugreek seed powder had a significantly lower rate of progressing to full type 2 diabetes compared to the control group. That finding is particularly relevant for anyone watching this who has been told their blood sugar is a little high or that they're borderline diabetic. The window between prediabetes and type 2 diabetes is a genuine intervention window, and fenugreek appears to help keep that window open longer. The typical dose used in the research that showed these effects is between 5 and 10 grams of fenugreek seed powder per day, taken with meals. Fenugreek seeds can be lightly toasted and ground, mixed into warm water, added to yogurt, or stirred into food. They have a slightly bitter, maple-like flavor that most people find manageable in small amounts. The most common side effect is digestive, bloating, gas, or loose stools, particularly in the first week as your gut adjusts to the increased fiber load. Starting with a smaller amount and building up gradually over 2 weeks significantly reduces this. Fenugreek can also lower blood sugar enough to interact with diabetes medications. So this is a non-negotiable conversation to have with your doctor before starting. Drop the word fenugreek in the comments right now if you've ever heard of this or tried it. I genuinely want to know how many of you are already aware of this research. The second seed I want to cover is one you've almost certainly heard of, chia, but probably not in this context. Chia seeds. Most people know chia seeds as a trendy health food, something to put in smoothies or overnight oats. What most people don't know is that chia seeds have been studied specifically for their effects on post-meal blood sugar spikes, and the mechanism is well understood. Chia seeds are approximately 35% fiber by weight, and that fiber is predominantly soluble. Like fenugreek, chia seeds form a gel when they come into contact with liquid. You've seen this if you've ever made chia pudding. That gel formation happens in your digestive tract, and it acts as a physical buffer that dramatically slows the rate of carbohydrate digestion and glucose absorption. A study published in the European Journal of Clinical Nutrition gave adults with type 2 diabetes either chia seeds or wheat bran with a high glycemic meal. The chia group showed a significantly lower peak blood glucose response and a lower overall glycemic load from that meal. The effect was most pronounced in the 2 hours after eating, which is exactly the window that matters most for preventing the kind of blood sugar spikes that damage blood vessels and nerves over time. Chia seeds also contain alpha-linolenic acid, a plant-based omega-3 fatty acid that has been associated with reduced inflammation. Chronic low-grade inflammation is one of the drivers of insulin resistance in type 2 diabetes. So this anti-inflammatory effect adds a second relevant mechanism. The practical advantage of chia seeds is how easy they are to incorporate. 2 tablespoons, about 28 grams, is the amount used in most research. They can be added to water, yogurt, oatmeal, or any meal without significantly changing the taste. If you're already eating a moderately high carbohydrate meal, adding 2 tablespoons of chia seeds to the same meal appears to meaningfully reduce the glycemic impact of that meal. For adults over 60 specifically, who tend to have slower gastric motility and are more sensitive to blood sugar swings, the blood sugar smoothing effect of chia seeds has practical day-to-day relevance. Now let's talk about the seed with perhaps the most surprising research behind it, black seed, also known as Nigella sativa. Black seed has been used in traditional medicine for centuries, particularly across the Middle East and South Asia. The scientific interest in its effects on blood sugar is relatively recent, but the results of several clinical trials have been notable enough to generate genuine attention in the research community. The primary active compound in black seed is called thymoquinone. In animal models, thymoquinone has shown the ability to protect pancreatic beta cells from oxidative damage, the kind of cellular stress that progressively destroys insulin-producing capacity in type 2 diabetes. Human trials are more limited, but the ones that exist are encouraging. A meta-analysis published in the Journal of Diabetes and Metabolic Disorders reviewed multiple randomized controlled trials on Nigella sativa in patients with type 2 diabetes and found consistent reductions in fasting blood glucose and hemoglobin A1C across the studies reviewed. The effect sizes were modest. This is not a replacement for medication, but they were statistically significant and consistent across different populations and study designs. A separate study published in the journal Complementary Therapies in Medicine found that 2 grams of black seed powder daily for 12 weeks significantly reduced fasting blood glucose, 2-hour post-meal glucose, and insulin resistance scores compared to placebo in adults with type 2 diabetes. The researchers also noted improvements in cholesterol markers, relevant because type 2 diabetes is closely associated with dyslipidemia, the dangerous pattern of elevated triglycerides and low HDL cholesterol. Black seed has a slightly bitter, peppery flavor. It's commonly used as a spice. It can be added to bread, sprinkled on salads, or taken as a supplement in capsule form, which is how most clinical trials have administered it. The typical dose in research showing blood sugar effects is 1 to 3 grams per day. The fourth seed I want to cover, and the one that's most commonly dismissed as ordinary, is flaxseed. Flax seeds contain 3 components that are each independently relevant to blood sugar management. The first is soluble fiber, specifically a type called mucilage, which has similar blood sugar buffering effects to fenugreek and chia. The second is lignans, plant compounds that have been shown to improve insulin sensitivity in multiple studies. The third is alpha-linolenic acid. the same omega-3 found in chia seeds, with similar anti-inflammatory effects. A randomized trial published in the journal Nutrition Research gave adults with prediabetes either ground flaxseed or a placebo for 12 weeks. The flaxseed group showed significant reductions in fasting blood glucose and insulin resistance markers. A key detail from this study: the flaxseed needed to be ground, not whole. Whole flax seeds pass through the digestive tract largely intact, and most of their active compounds are not absorbed. Ground flaxseed or flaxseed meal is what the research consistently uses. 1 tablespoon of ground flaxseed daily added to oatmeal, yogurt, or a smoothie is the amount associated with most of the blood sugar research. It has a mild, nutty flavor that most people find neutral or pleasant. Now, here is the most important thing I'll say in this entire video. None of these seeds work in isolation. The research that showed meaningful effects on blood sugar did not involve people who were sedentary, eating poorly, sleeping badly, and taking a seed and expecting it to compensate for everything else. The studies that showed the strongest results were conducted in people who were otherwise managing their diabetes through diet, medication, and activity. And adding the seed produced an additional clinically meaningful improvement on top of that baseline. Think of these seeds as tools in a larger strategy, not as treatments on their own. The most powerful intervention for type 2 diabetes management in adults over 60 remains consistent physical activity. A 20 to 30-minute walk after meals, not before but after, has been shown in multiple studies to reduce post-meal blood glucose by 15 to 20% on its own. That is a larger effect than any single seed in any study I reviewed for this video. Walking after meals takes advantage of the fact that your muscles become a glucose sink during movement. They absorb circulating glucose directly without needing insulin through a separate pathway involving GLUT4 transporters. This mechanism works regardless of your level of insulin resistance. Sleep quality is the second factor that is consistently underestimated in diabetes management. A single night of poor sleep has been shown to reduce insulin sensitivity by up to 25% the following day, equivalent to gaining several kilograms of visceral fat in terms of its metabolic impact. For adults over 60 who are managing blood sugar, protecting sleep is not optional, it's metabolically essential. And finally, reducing the glycemic load of your meals matters more than eliminating any single food. Pairing carbohydrates with protein, fat, or fiber, and that includes any of the seeds we discussed today, consistently reduces post-meal blood sugar spikes more than removing the carbohydrates entirely for most people. This is why these seeds work best when taken with meals rather than at other times. Here is exactly what I want you to do this week. Step 1. Talk to your doctor before adding any of these seeds if you're on blood sugar medication. This is genuinely important. Fenugreek and black seed in particular have documented glucose-lowering effects that can compound with medication and cause blood sugar to drop too low. Your doctor needs to know. Step 2. Choose one seed to start with. Don't add all 4 at once. Start with the one that feels most practical for your eating habits. Fenugreek powder with warm water before a meal. 2 tablespoons of chia seeds added to your breakfast. 1 tablespoon of ground flaxseed in your oatmeal. 2 grams of black seed powder in yogurt. 1 seed, 1 week, so you can track whether anything changes. Step 3. Check your blood sugar at consistent times. If you're monitoring at home, check fasting blood sugar each morning and post-meal blood sugar 2 hours after your largest meal. Give it 4 weeks before drawing conclusions. blood sugar fluctuates day to day. 4 weeks of data tells you something meaningful. Step 4. Add a 10-minute walk after your largest meal this week, just 10 minutes. Research shows this alone meaningfully reduces post-meal glucose. Combined with any of the seeds we discussed, the effects add up. Step 5, protect your sleep this week. One practical step, stop eating 2 to 3 hours before bed. Late night eating raises overnight blood sugar and disrupts the sleep-related hormonal cycles that regulate insulin sensitivity the following day. This one change, consistently applied, produces measurable improvements in morning fasting glucose for many people within 2 to 3 weeks. Your blood sugar is not a fixed number. It responds every day to what you eat, how you move, how you sleep, and yes, in a modest but real way, to certain seeds that have been studied specifically for this purpose. The research doesn't promise miracles. It promises modest, consistent, compounding improvement over time. And for adults over 60 managing blood sugar, modest, consistent, and compounding is exactly what long-term health is built on. Thank you for being here. Please subscribe. I cover topics exactly like this every week. Leave a comment and tell me which of these 4 seeds you're most interested in trying. Your question might be exactly what someone else watching needs to hear answered.